This is One-on-One.
I really didn't think anything was wrong, but I knew something was wrong. I was having trouble with my bladder, and I went to see Dr. Pearden, who's my urologist, and he gave me the news that I had cancer. I could have went to regular therapy for 42 days for 15 minutes, or I could have went for CyberKnife treatments for 5 days for about an hour and a half. And he told me between two options, the CyberKnife was the best bet. And about 2 months after I received my last treatment, I went for another PSA test, and my PSA went down from 6.9 to 1.6. And my urologist was quite happy with it. The Dr. Danish was more than happy with it. And I guess, needless to say, I'm happy with it.
The other gentleman who's happy is the gentleman who was just referred to, Dr. Adnan Danish, Medical Director of Meridian CyberKnife Center, Riverview Medical Center. Now that was Sal we just saw.
Yes.
You know Sal.
I know Sal. I know Sal very well. He had come into my office to discuss options with regards to his prostate cancer. And as many know, there are a lot of options that one can pursue.
For prostate cancer?
For prostate
Probably
cancer.
put it in perspective, doctor. How common is prostate cancer and with whom?
It is probably the second most common cancer in men, one of the leading causes of cancer in men. So it's a very important cancer to know, very easily detected through simple blood tests and follow up with the physician. And there's a lot of awareness about it. So it's a very
when do you get
important
the
cancer.
test?
So usually right around 50 is when people start to do the annual screening. They'll do an annual PSA, and then depending upon the results, then doctors can kind of move forward with what a workup is necessary.
Early detection critical.
Critical.
Why?
The earlier you catch it, the earlier stage you catch it, the higher chances are of cure. And that's the truth of any cancer, and certainly for prostate cancer.
Now put the CyberKnife piece in place, because this wasn't always available.
No, it wasn't. So traditionally we had surgery, we had intensity modulated radiation therapy, which is
you did that fast.
I'm sorry, IMRT.
IMRT.
So that is the 9-week course that most patients will refer to, a doctor refer to.
Right.
And then there is CyberKnife. Now, CyberKnife in the recent decade has, in my mind, revolutionized how we treat prostate cancer. It has allowed us to make it more convenient to hopefully cure a patient of his cancer.
What does it do?
So what it does is it focuses high doses of radiation to our target. So in this case, it would be the prostate. It does it with tremendous accuracy. It has the ability to dynamically locate the target, which in this case would be the prostate, and focus all the energy and radiation to the organ. Because of that tremendous accuracy, we're able to, in layman's term, pump up that dose per day. So we can, what IMRT accomplishes in 9 weeks, we can accomplish in 5 days. So Sal, he had a 1-week course. He started on a Monday and then on a Friday, which is a tremendous, I think, advancement in the treatment of prostate cancer.
And the impact in terms of what you've seen in patients who have gone through the CyberKnife process, the treatment and the process. What do you see in them?
So it's really their quality of life. You don't have that time commitment, that large, the 2 months, depending on the weather, the season. We have a lot of seniors that, were certainly very nervous about coming to treatment every day. And when we say, and we have a lot of professionals who are working, who would otherwise have to find a way out of the work schedule to get treated. Well, for them to dedicate 1 week, it's almost life-changing in that you can get your treatment. It's not invasive. You are able to maintain all your activities of daily living and be done with it in 5 days. And that has, I think, changed people's perception about, or their hesitations about coming and getting treated.
Who's a candidate? Who's not a candidate?
So the candidates are patients who have low-risk disease. What that means,
low-risk disease.
Right. What that means is the risk of the cancer being outside the prostate, or how aggressive the cancer is. So patients with a Gleason score 6, and that there are 2 ways. There are certain things, or indicators we look at when we treat prostate cancer, and we try to categorize them in terms of where they should be in terms of their treatment. So their Gleason score, their PSA.
Hold on, their Gleason score, The PSA, break that down in layperson's language.
So Gleason score is what the cancer cells look like under a microscope, how
Right.
aggressive it is. We treat patients with low or not as aggressive disease. So the number 6 represents cancer that's not as aggressive as maybe 10. 10 is the highest number. A PSA generally less than 10. That also will be patients who we consider for CyberKnife, and a low clinical stage where we do a physical exam and see whether or not we can actually feel the cancer, and that also plays into the prognostic group.
Doctor, let me ask you this. I mean, obviously there's been tremendous advancements in this field over the last few years. A lot of information out there, but we can't do enough. We've been doing as much as we can over the years, still need to do more. Why are so many men so ill-informed or don't have enough information about this? So therefore don't do the right things at the right times to protect themselves. I know that's a gross generalization, but it's not inaccurate.
It's not inaccurate, and I think it has to do not only with the misinformation or the lack of information, but I think also with too much information.
Too much.
You know, you have a lot. Prostate cancer is one of those cancers that's studied very well. There are a lot of options out there that can accomplish the same goal. Our main goal here is to cure the cancer, but our secondary goal is to do that at minimal cost to their quality of life. And so there are a lot of considerations that go into picking or choosing a particular treatment option. And the only way a patient can do that, or the best way they can do that, is to go to a multidisciplinary clinic or center.
Make that clear, because
So
someone
that
right now
means-
says, well, I'll go on the internet, doctor, I'll be fine.
Okay.
You say, I'm going on the internet, I'll be okay, I'll find my doctor on the internet.
Well, the internet will give you some information, but what you want to go is you want to get to a center that offers all the disciplines under one roof. So you have your urologist, your oncologist, your radiation oncologist, and a team that can confer and concur and talk about your case and come up with a treatment plan that works for you. Whereas oftentimes, if you pick your doctor off the internet, you're getting your care kind of piecemeal, because you're going to one office, then you're being sent to another office, and rather than being a cohesive treatment plan, which is very important in any cancer care, especially prostate cancer, you're getting piecemeal. So I think that's why patients have a difficult time making that decision, because they're getting different opinions from different schools of thought. I think it's important for patients to go to a cancer center that has all of that under one roof, so we can all discuss that and make sure we come up with the appropriate treatment option.
Before I let you out of here, you love what you do.
I'm sorry?
You love what you do.
I love what I do.
Because?
Well, I personally had experiences with cancer, and that gave me a mission, and I love the patients I treat. I think that most patients we treat are very focused and just want to get better, do the right thing, and it's very easy to treat people like that.
Dr. Adnan Danish, I want to thank you for joining us. Don't let it be the last time you join us, because we respect and appreciate and admire people who not just love what they do, but make a great impact, have a great impact in what they do. Thank you very much.
Thank you for having me. Thank you so much.
Stay right there. We'll be right back with One-on-One right after this. Thank you, Doctor.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating 25 years of broadcast excellence. Funding for this edition of One-on-One with Steve Adubato has been provided by the New Jersey Education Association, working for great public schools for every child, Wells Fargo, the Adler Aphasia Center, PSE&G, committed to improving New Jersey's economy and strengthening its communities, New Jersey Manufacturers Insurance Group, auto insurance, homeowners insurance, and banking under the principle of stewardship, the law firm of GIBBONS PC, Horizon Blue Cross Blue Shield of New Jersey, making healthcare work, and by Bloomfield College, offering small classes and big opportunities since 1868. Promotional support provided by the Star Ledger and NJ.com, Everything Jersey, and by NJ Biz, All Business, All New Jersey. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. One-on-One with Steve Adubato has been produced in partnership with St. Joseph's Healthcare System.